Hello there, I'm Nick Williams with Medicare Millionaire, and I'm here to set the insurance world straight with brutal honesty. And I'm going to talk to you about phone sales today, and I'm going to teach you how to be highly successful. I'm going to give you an outline to be highly successful selling insurance over the phone, selling Medicare insurance, starting with, but other products as well. And I'm going to tell you how you must approach this, the mindset you must have, and the process that you must follow. But understand, first of all, that there are different types of phone sales. There's call centers, there's CMS-approved call centers. They've got to follow a script. Their phone calls are recorded. They're probably getting leads, and they're probably W-2'd employees, and they probably will tell you they close 50 deals a month, and they all close 50 deals a month. But they've got probably inbound calls, and I guarantee you, because I've trained big call centers, highly successful call centers, they don't all close 50 deals a month. I assure you, maybe in the AEP at full bore with knowing what they're doing, they might. Most of them don't, okay? Now, there also is the call center that's not CMS approved. The difference is that those agents, they're not under the CMS thumb, okay? So if you want to build a call center, you can go ahead and build one. You don't need to be CMS approved from the standpoint of just having many agents. So how you define call center, of course, is important. So I'm going to call this many agents working on the phone, right? You may be getting leads, you still might be W-2'd, and you still might be getting inbound calls, and you still may have a script, but you're not on that CMS approved script, okay? Now, you must always be approved to sell. When you're selling Medicare, especially Medicare Advantage, you must be compliant, okay? So that's a given. You do have more ability to vary off the script there, okay? But even there, and let me just keep moving forward because I want to get to the broker. Even there, you are going to close maybe 5 to 10% of your deals. That's it, okay? So again, we talked about somebody closing 50 deals a month. That's typically going to be inbound and a lot of inbound calls. That's a lot of calls. In this scenario, people can do the same thing. It's a lot of inbound calls, perhaps, and outbound when you don't have an inbound. That's somebody working very hard if they're maintaining that clip. And again, there's exceptions to every rule. Somebody's going to say, well, Nick, that's not how my call center works. But so I get it. There's always exceptions to the rule. One other characteristic of these two types of phone sales systems or programs is that the agent's typically not paying for their leads. Again, they're not paying for their leads. They're often getting inbound calls, or they're getting a lot of leads. They don't own their business. They're W-2'd employees often, or licensed only agents often. Now, there's the next category, which are brokers, or you might be a licensed only agent, which is fine, which means you may work in an agency and you're getting a lot of support, or you want to build an agency with LOA agents. There's nothing wrong with that. Okay. In that scenario, you are now typically going to find that you're going to find yourself in a situation, and I'm going to use the individual agent. Okay, you're working. You got your computer at home. You're doing phone sales. Okay, understand this: you're not in phone sales as much as you are an insurance agent. You are an insurance professional. You are not getting a bunch of inbound calls. You can't afford to just work your way through leads and grind through leads and spit them out the other side and grab 5 to 10%. You have to be a professional. And you are. And understand this, these people, they can tell. So you need training, you need sales training, you need product training, you need organizational skills, you need to show them, but they'll understand this. They'll understand they're talking to a professional because you're not reading off a script. And you're human. You have a more human quality. Again, not that working in a call center, you're not human, okay? but you have a more, you're interacting in a different, there's a different dynamic going on, okay? Now, in this scenario, again, first of all, you got to do all the things that people have to do to hook somebody into a conversation. I'm not going to get into all that. I talk about that frequently. But you need to be an insurance professional, okay? Once you get them engaged in the conversation, then you need to go through, now here we use the 4-product progression. So you need to approach this as an insurance professional. And create a relationship, right? Perhaps get referrals, right? And perhaps go through cross-selling methodically, do a fact finder, all those things. So if you approach this as an insurance professional, all right? So now you have a person, they're speaking with you. All right, so you've created a relationship. I don't think at that point that you can count on just being a Medicare agent. You can, all right, and many do, but you need to be able to go through a progression of products. You need to be able to go through, to talk to the client, do a fact finder. Okay, understand when people work in a call center, for the most part, they simply go through and they ask some basic questions and give everybody the same product or the same type of product. They're not really thinking, but you have the opportunity to think. You have the opportunity to use all your skills, to do true fact finding, dig down, find out what this person needs, what they want, and how you can help them. You have the opportunity to, if they don't need Medicare, to say, okay, we've discussed Medicare. That's not something you need to address. Let's talk about your life insurance. Okay, let's talk about your hospital indemnity because you have a Medicare Advantage plan and you need to address this daily copay situation. Let's talk about, I was just speaking to an agent and he brought up dental insurance. You can talk about that. I'm not a big fan of dental insurance, but you can talk about dental insurance. You can talk about a lot of different types of coverage. I like the 4-product progression, which is Medicare, final expense, indemnity, which is that hospital indemnity. Some people like cancer. And then once I establish that client, annuity. Okay, so that's my progression. Again, it's Medicare, final expense, indemnity, annuity. That's the 4-product progression, okay? And if you do this, you might think, I don't know anything about annuities. Well, you're gonna learn. That's all there is to it. So you've got to learn these things. You've got to learn, if you're going to be an insurance professional, this is what matters, nothing else matters, except your children and your wife, okay? Tell your friends you'll see them in a couple years. You've got to knuckle down on this and learn this stuff. But you go through the 4-product progression and you tell the person, I'm going to be your family agent. I'm going to be your family agent. You go through your 4-product progression, whatever your products are, you go through the progression. And by the way, dental insurance is something good to talk about. I just don't find a lot of benefit in selling it. You know, from my perspective, it hasn't been fruitful for me. But you may differ in that. And I do talk to agents that love dental insurance. So again, you want to sell them. You want to be able to go through a progression of products. You want to establish a relationship with them and get referrals from them, right? It's just like if you were sitting down with them, and this is the perfect time to do it, because you can say, listen, Bob, I'm glad I could help you today, but I need your help. And this is the oldest referral close in the book, okay? And you'll find that very successful insurance companies were built, entire insurance companies like New York Life, Northwestern, they use this type of approach. I need your help, okay? So again, I've helped you, can you help me? I need help building my business. And I would like to know who it is in your family that I could provide my services to. Okay, so do you have any brothers, cousins, uncles, mama, daddy, children, or anybody else that could use my services? And you just wait. Then you go next. How about church organizations, social clubs, anything such as that? And then you wait. Professional organizations. Bob, do you have one of those old-timey address books? Maybe you could go through that and find somebody. And you stay on it. You stay on it. Listen, this is a tough business. You need to push, okay? And you close it like anything else. And let me tell you, when you get that referral and you call those people, they're easier to sell than the first client. Because you call them and say, it's like, hey, Billy, your dad told me to call you. He told me to call you and help you out with your insurance. It works better. But listen, you have to become a professional, all right? So it's the difference between a hit it and get it guy that's selling at the door and somebody who becomes the family agent at the door, okay? You now have an opportunity to be not a hit it and get it agent over the phone, but instead be somebody's family agent over the phone. People do this with Medicare alone. But let me tell you something. If you're speaking to somebody and they're good with their Medicare, but you've developed rapport, man, that's worth its weight in gold. That you're talking to somebody and you're clicking, that you've developed rapport. I would tell them, I would say, hey, Ethel, I'm happy that, your Medicare is taken care of. We've developed some real rapport here, right? So I want to continue this relationship. I do. You could say that. I want to continue this relationship. As your insurance agent, I can't help you with your Medicare, but there are other needs that families have. For example, now don't go into P&C, please. It's just, I never see it working. I never see insurance agents, life and health insurance agents. Okay, again, somebody's gonna say, well, I do it. There are exceptions to every rule, but I just don't see it often. But instead you say, Ethel, how about your life insurance? When is the last time you've reviewed that, right? Simple as that. Hey, if you're getting along with this person and everything is, you developed a nice relationship, let's exploit that relationship, right? And then if you're able to sell something, great. If not, Ethel, who else is it in your family that could use my help? Obviously, you appreciate my knowledge, right? Yes, I do, Nick. Well, let me ask you, do you have any sisters or brothers in a similar situation where they may need help with their Medicare? Why, yes, indeed, I do have a sister who needs help. You have to act like a family insurance agent over the phone. It's time for this. Because you tell them, say, you know what, Ethel, it used to be that the agent came to your house all the time. Now people, with all this virus stuff, people don't do that as much anymore. And, and I found that it's just as easy. And you can tell them, we can even get on what's called a Zoom call. You know what that is. Older people do that. You can FaceTime them. Hey, how are you? Right? You can do that. So here's the trick, is act like you're a regular agent. Don't act like you're in phone sales. Act like you're a regular agent. Develop rapport. Take time. If you're sitting down with somebody, if you go to their home, you sit down with them. You might be there, unless you're in the hit it and get it business. But if you sit down with somebody, you're going to sit down with them for a half hour, 45 minutes to discuss their insurance needs. Again, unless you're a hit it and get it agent. All right? I always sit down with somebody. I call it camping out. I want to camp out and just find out what's going on here. Because all of a sudden something pops up, right? It's like, oh, you have a 401k that you've been wanting to roll over. I can help you with that. Go get your documents. Let me look at those. So you can do the same thing over the phone. By the way, 401k rollovers are probably not the first sale you want to make. That's especially over the phone. It's good to sell something smaller up front and evolve into that 401k rollover. But let me tell you something. By you doing this, you can earn a fortune, because you can build a business that has legs, that has you put these people into your CRM, you send them birthday cards, you call them on policy anniversaries, right? You send them 4th of July cards and Thanksgiving cards. People don't get those cards. People don't even get Christmas cards. Sometimes I think nobody likes me anymore because I don't get Christmas cards the way I used to. Sometimes I wonder, where are the Christmas cards? And then all of a sudden you get one from your trusted agent. Hey, Ethel, how are you? Merry Christmas to you. Love, Nick. I don't think you put love, Nick. Your agent, Nick, okay? And then you build a business. This is a long play, but let me tell you something. You could come out of the gate hitting a home run. And I've got agents doing it. They are doing this. And they're usually agents that care and agents that aren't just all uptight trying to rush through a call. They're friendly, they're enthusiastic, they bring some joy and a good solid presentation of a well-adjusted person to the phone call, right? Somebody who has some humor, perhaps, because you don't want to bore the hell out of these old people, right? So listen, become their family agent. That's the ticket. We train agents every day. We're in training every day with agents, and that's what you got to do. And because you've got to hone your skills in all these different areas. So you have to do some training on the hospital indemnity. You have to do some training on the life insurance. You have to talk about long-term care. You have to understand what long-term care is. What is the purpose of it? What is the cost of a nursing home? Is long-term care practical for somebody who's 65 years old? Probably not. Probably it's too expensive for the person you're talking to. But you need to be able to have these conversations. You need to be skilled, and it takes time, but you can get in there, start mixing it up right out of the gate. And if you're in a good agency where you have people who are resourceful and you have professionals that you're working with, they'll be able to give you guidance on these situations. And then you'll learn how the next time you run into that, you'll be able to handle that situation. So there ain't no easy tickets, all right? All right, so, all right. That's it. I wish you well, and I hope that you can build a big book of business of people that care about you just as much as you care about them, and care about your business just as much as you care about that they're properly protected. We'll see you later.